I rotated as a third-year medical student during my obstetrics gynecology rotation, and I think when I met the people in the division, I felt like those were the people that I could see myself working with in the future. I think our patients are looking for like improved quality of life, and I think the quality of life factor is what I was looking to improve as a physician, and then luckily also as a surgeon. I think first of all, just the faculty and the people. Luckily, with the research, I think all of our faculty have different research interests, which is just good going into fellowship because there's a lot of opportunity to do different projects. And also, kind of falling into it, we now have Dr. Cox, who is a new faculty member that I didn't originally interview with. But I think all of our faculty do surgeries different ways, and so we have a lot of breadth in our surgical training. So now looking back, I'm really glad that that ended up being a strong component of our program, which is why I would have chosen it. It's just I kind of fell into it. Very positive. I think at Wisconsin, the obstetrics gynecology department is all very close-knit, and they stay well connected within division. And everyone's just been very welcoming and encouraging. And I think research-wise, we have a lot of resources and help with our projects. So it's overall been a great experience so far. I have an interest in more like perineal trauma, like obstetric anal sphincter injuries. I think in residency, I met quite a few patients that were severely affected by lacerations and anal sphincter injuries that they had during delivery, and seeing the impact and effect it had on their quality of life, but just like overall like attitude and just how it affected them moving forward, kind of like in every part of their life, was pretty impactful. And so kind of just inspiring me to try to find ways to help them, and overall goal to prevent those types of injuries. So we have our faculty. I think the main, step is figuring out, what your research interests are, and then kind of pinpointing a faculty that may have similar interests. Once you have your research mentor, just figuring out your project, but we have more like research support, like Amy Godecker, and different people more with like funding and like grant support. The teaching environment is pretty laid back. I think also, obviously varies from faculty to faculty, but there's also a lot of independent like learning, which is nice because I think in residency you're used to being like so closely watched, and sometimes you can't really make like the decisions that you would make if like your faculty wasn't next to you. But I think you do get a lot of independence working with patients in clinic and doing like your own surgical counseling and just management counseling in general. So that's been a nice surprise and experience in fellowship, because I think you're ready to do a lot more things on your own. I think we get a lot of clinical experience, but also surgically. Like I mentioned before, our faculty are so diverse surgically in how they approach things, and then also just the modality, like vaginal versus like laparoscopic, and then also robotic surgery. So we learn how to do everything multiple different ways, with vaginal suspensions and also with like sacrocolpopexy. I think another big strength is we have like two urology trained urogyn, like fellowship urogyn trained urologists. So a lot of programs, when they rotate with urology, it's general urology. Some of it, is more applicable, like, bladder, ureter repair. But for us, we actually have urologists that are urogyn trained. So it's much more specific, and it's been a big strength learning how like they approach problems kind of from their different urologic mindset than like we may approach a problem from like a gynecology standpoint. So moving from Texas, people don't believe me when I say like I love living here for the seasons, because the winter is much colder than we ever experienced in Texas. But I love the seasons. I love the change month to month, and actually knowing where you are in the calendar year based on what it looks like outside. I think also the size of Madison is nice because there's a lot going on, and you can know what's going on like every weekend or with the farmer's market. So there's always things to do, but it's not so big to where you're missing things, or it's hard to go to different activities or events, but it's still small enough to where it's not like a headache getting there. I think other fellowship programs are maybe looking for like the same type of applicant year to year, because like, you know, if they find the same applicant that fits like the same mold of their program, then like they know that fellow is going to be successful. I think for us, we're looking for people being like unique and different year to year, applicant wise, because I think that's what we pride ourselves in, is our department being very diverse and like we all do things differently. So I think we embrace someone being different and not like the rest of us, which I think is cool.